far as the daily salt consumption, just 3.8, 15 grams per person. And in many countries, much of the food sodium comes from processed foods such as bread, cereal, grains, processed meats, dairy products, and something that we know is efficient and effective in order to reduce sodium intake of the population is reducing the contents of salt of those foods which are consumed frequently. In most of the developed country and a very never larger number of developing countries, the salt intake by people comes 70-80% from processed foods and also foods which are served at restaurants. This is why, in order to reduce salt consumption among the population, it is basic to promote the reduction of sodium in those foods so that they may have less salt. And indeed, this ought to be one of the main measures to be taken into account. Plus, the fact that the sale of such processed and processed foods continues to increase in our countries. And on the graph that you see on the left-hand side of the screen, you see the trends in the sales. And you can see clearly how is it that average sales per capita of these processed goods between 2019 and 2024 have grown, and they continue to grow after 2015 for the group of countries that we have been analyzed: Republic of Argentina, Brazil, Chile, Colombia, and Venezuela, which already have more than 20%, 80% of the population in our region. And sales increased by 8.3% between 2009 2014, and there was an envisaged increase of some 8 or 9.2% per capita as of 2019. So it is basic that we may be able to promote measures that will reduce sodium concentration in such products.
Now, as far as interventions and how we're going to tackle this problem, we know that these were some of the best investments in the Department of Non-Communicable Diseases, surveillance to measure and monitor the consumption of salt, working with with industry to promote reduction of salt in food products for them, again, to have less salt, and standards for labeling and marketing also needs to be regulated for that, for labeling to be accurate and to convey this information to people, empowering them to consume less salt and adopt healthy lifestyles. To this effect, updating these goals presented here today is a key strategy to offer political guidance for regional health guidelines can improve the lives of many people. There are other efforts in line with this nationally that also seek to be a regional benchmark for reducing salt or sodium products in food, salt content in food products. We've been mapping these national policies and initiatives that report salt content in the Americas. We identify the gaps in the adoption of policies according to the cost-effective interventions indicated by WHO to prevent and control non-communicable diseases tied to food, looking at the policies and laws, regulations in states, and encouraging the use of information on gaps in establishing such policies, make it possible for there to be discussion and launching or setting of priorities in our region along these lines. This tool, which is interactive, we can share the link with you or find it on our web page, enables us to look at all the information regarding national policies and initiatives that seek to reduce salt intake, monitoring the implementation of WHO best investments and provide information on gaps in the adoption of these policies to encourage these actions. Much progress has been made in the region regarding the adoption of policies with the use of front labeling, for example, such as Colombia and Mexico, which are out in front on that practice. Hopefully, Argentina will be in short order among those countries that are using frontal labeling. And hopefully that will change consumers' buying choices and also to prevent those products which have excessively high levels of salt in schools and other similar environments. And so it's really difficult to achieve or to gauge the degree of implementation of these policies. It's quite heterogeneous across the region, but we would call upon countries to redouble their efforts to reach by 2025 the world goal, which is to achieve that 30% drop in sodium salt intake by the population so that we can achieve that goal as set in the Sustainable Development Goals. Now, on this slide, I want to show you the publication that goes along with the launching of these new guidelines, these new goals. So that's what this meeting is about. This hopefully will help countries implement these goals. Both documents are already available. That is, it's the same document in two languages. Now let's talk about a few specific matters. These goals were meant to be an update of the first set of goals set in 2015. And now, well, the time had come for a number of reasons for us to update these goals. One of the uh, development goals on salt targets. And if you look at the data that we've collected throughout the region, we see that a large array of products had already met those goals set in 2015 for salt intake, which unfortunately is still too high in our region. So that is a reason why we needed to update the goals from 2015, and more countries have set dietary salt intake. And so by updating it, hopefully we would include more subcategories of products, not just the original ones, and their PAHO published its model legislation based on WHO targets, and some countries of the Americas have introduced and proposed labeling standards and thresholds for sodium content in these food items, hence the importance of revising these goals and guidelines. At the beginning of this year, WHO launched its world benchmarks in different food categories, as we've just heard. And these benchmarks are based on the work done and the experience at the national, regional level in these different categories. I'm mentioning these regional updated goals here today to say that they are in line with the world indicator set by WHO. In the next presentation, we're going to look more in detail at this, but here you have 16 categories that are being included in these goals. And I would just briefly mention that in 2015, we had 18 categories, now 16, but 75 subcategories are included in this update. Many of the ones in 2015 were broken down into more detailed subgroups. By way of example, the 2015 goals had a category for all bread products. And currently, we have 4 subcategories of bread, the different types of rolls, wraps, uh, loaves, and there's a fourth category for other types of bread items. Going on to the next slide, on this table, you can see how the goals are being presented. We included the name of each category and subcategory, as you can see on the far left of the table. And in the next table over, we have a description recognizing the uh, heterogeneity of names that may exist in the different countries for these subcategories. The last 4 columns are the goals. The first for 2022, thinking of progressively moving toward them. And in the next column, we have the 2025 goals. And as I said before, the next speaker is going to flesh this out more, but we are also including 2 columns with the um, milligram sodium breakdown in those 2 columns according to the thresholds that are indicated by WHO. What we want to avoid is for a product that reaches a goal to be recognized as one that's not excessively, uh, that doesn't have an excessive level of salt. Because just because it met the guideline doesn't mean that it's not still too much salt in that product. That's why we wanted to have these 2 columns with this additional information to uh, explain that. Now, those products that, even though they may have met with the reduction goals, they might still have an excessive amount of salt. And so that needs to be taken into account when we look at all the other policies, such as front labeling. We're going to have to continue regulating these products in line with these policies. So we have to reach an agreement, an easy way, rather, of identifying these products. Yes, there are products that have met the goal through reduction, but we still have to be able to see if it has an excessive level of salt and if there aren't any other ways of regulating it. Now, on this slide, we have other publications that will accompany the launch and publication of these goals. Hopefully, this will be a technical policy tool that countries can use to implement the goals. So we're talking about brochures with the commonly asked questions and other data, which can serve as input, a tool for countries. And this information, as I said, once we conclude this webinar, will be made available on our web page. And hopefully, in short order, we will have the translation into Portuguese. We stand by to complement this information through technical meetings, advice, answer questions as governments require. Again, we're striving toward that goal of reducing salt intake by 2025. This could be done as a compulsory, through a compulsory approach, but better increases in one's quality of life could be achieved. And there should be a regulatory framework adopted for companies of all sizes to be able to operate on an even playing field, on equal footing. It's really hard to do this otherwise. For example, when there's a change of a government, unless it's set in law. We have the example of Argentina, which has its national law, which sets goals, and that shows not only the feasibility of going down this path, but also the goals themselves were put together that such that they would be feasible in line with those benchmarks set by the WHO about which we spoke earlier. That concludes my talk. I and my colleagues who have been working on this agenda stand by for any support you may need to assist in the implementation of these goals. Here you can find the link for the SALT section of our web page for you to find all of the technical material and any other material that can be useful for these information, awareness, raising campaigns to complement what you're doing in your countries. Reducing salt is one of the most cost-effective public health measures to save lives from NCDs, to avoid cardiovascular disease. And this should be one more goal among other complementary goals that will enable us to achieve good diets and better health in the populations of the Americas. Thank you. Thank you, Fabio. Your presentation was very clear. And I would just mention that these documents are going to be available in 15 minutes time. These links will be active in 15 minutes for you to download them. And feel free to ask questions in the Q&A tab.
Continue with the next presentation of Marie Labe. And Marie Labe is professor of the Department of Nutritional Sciences and director of the WHO Collaborating Center in Nutrition Policy for Chronic Disease Prevention of the Faculty of Medicine in the University of Toronto. And she has led the team together with Ontario Tech University to do all the technical work, including data compilation and analysis and the development of the updated targets. So now we are going to hear a little bit more about the science and methodology behind those targets. So thank you very much, Mary, and you have the floor.
Thank you very much, Leo, and thank you to all the members of both the TAG and to all the attendees and the other delegates who are here today. So as Leo just mentioned, I'm going to overview the methods that we used in order to develop the targets for the update. My screen's not moving. I'm just going to restart my screen. Excuse me, folks. There. Yes, now it should be sharing. Apologies for that. So I think
sorry, we can't see it now. If you like, maybe we can project from our side. We're not seeing.
Let me go to screen share again.
Yes, we can see it now.
Okay, I'll go to full screen. Can you still see it?
Yes.
Okay, thank you. So there were a number of reasons for updating the regional targets. First, it was part of the consensus statement when the targets were released in 2015 that they would be updated. And that was further recommended by the earlier meeting of the Technical Advisory Group for Sodium. And as we looked at the data that came out in the interim, we knew a number of foods were already meeting the 2015 targets. And as you heard, that in order to meet the WHO targets, we will need more ambitious targets and thresholds as time moves on. And since the time when the other targets were set in 2015, many more countries have also established both sodium reduction targets and have sodium monitoring data. And of course, we have a number of policy initiatives that Fabio mentioned earlier. For example, PAHO has a nutrient profiling model, as do many WHO regions that all involve sodium. A number of countries have adopted front of pack labeling, and we have the global benchmarks for sodium, all pointing to the need to redo and update our sodium targets. So my task today is to update you on the method that we took in order to update these targets. So I would be remiss if I didn't acknowledge the huge amount of work that was done. It wasn't just me. There was a core working group, part of the WHO Collaborating Center at the University of Toronto, as long as colleagues at the Ontario Tech University, as well as a number of staff members at U of T and students, as well as the grateful support and participation of a number of members of PAHO staff members. We also had a subgroup of the TAG working group who also met with us a number of times to provide comments, review material as we evolved, and gave us a lot of good direction. Additionally, I'd like to acknowledge a number of days that were spent by the TAG group. We met 3 times over the course of developing these updated targets, and the TAG group were very influential in both reviewing the available data that we had to work with, discuss the pros and cons of the different methods that we would use, and how then we could apply those methods to the food data we had, and then obviously made final recommendations on both the methods we would use and the final draft targets, which were then presented to PAHO. So what was different this time when we were setting the targets for 2022 and forward? When we set the targets in 2015, we basically set those targets on the targets that have been set in 4 countries in the region, and they were, you can see them here, as well as reviewing the targets that have been set in the UK. But we had very little monitoring data available to us from actual sodium levels of foods within the region. Turn around now, about more than 5 years later, we now have targets from 10 countries in the region, as opposed to 4 or 5 years ago. We also made sure that we aligned with the WHO, who were drafting their targets while we were drafting our targets, and also examined the targets that have come out of the UK, because obviously they have been the country that have been at developing sodium targets for the longest period of time. And amazingly, and I think with the support of many countries from both PAHO and a large research project supported by the IDRC, the International Development Research Center in Canada, we now have sodium monitoring data from 19 countries in the PAHO region, as well as a policy document that was reviewed, and Fabio showed a link to it, and it's available on the website. And so we had a lot more data to work with as we set the targets up this time. So how did we do it? The targets this time, I would say, were a data-driven approach. And so we set our targets based on milligram per 100 gram, which is the traditional way of setting targets. And so they were set for 2022 based on a 15% reduction of the median levels that were achieved from data that was collected between 2013 and 2015 on the most cases. And those levels were then reduced by 15% to come up with the 2022 targets, and then by 30% to come up with the 2025 targets, consistent with the 30% reduction goal from the World Health Organization. We also set targets for milligrams per kcal, and this was important for 2 reasons. First, to identify those products which are dense in sodium. In other words, they contain per calorie a large amount of sodium. And if you know that we normally would recommend 2,000 milligrams of sodium on a traditionally 2,000 calorie diet, foods that present several milligrams of sodium per calorie are therefore very sodium dense. And so that would allow countries to also particularly, for example, recommend in their food guidance that certain foods should be either consumed less often or potentially look for sodium reduced options. So we presented the data in 2 different ways. And the long-term data are based on countries trying to achieve the levels that are seen at the 25th percentile. In other words, a quarter of the foods were already at this lowest level within the countries, and looking at front of pack targets and other thresholds that we had available, which would be our most ambitious targets. As well as we conducted feasibility assessments to make sure that the targets, and I'll explain that a bit later in the next few slides. So I'm going to walk you through bread products, and this is a category, and I think there's many categories, as Fabio mentioned, but if you understand what we did from bread, you can see how the same methodology was applied to the other food categories. So the first thing we did was we looked at how many foods were meeting the original 2015 PAHO targets. And as you can see from the data that we had already collected by 2015, over 83% of bread products were already meeting the 2015 targets. And you can see a couple other studies that were done in 2017 and 2018. So the large majority of foods within Latin America were already reaching or meeting the regional targets, as well as a number of foods, usually over 50% of foods were already meeting the lower targets. And that really said that the region was ready for more ambitious targets if we were going to meet the WHO targets. And our targets originally, if I use bread, for example, was 600 milligrams of sodium. But bread products were presented as one large category with very, very wide range of sodium. And so in the new targets, what we did is, because we had so much data available, we were now able to examine the bread sodium levels amongst a large number of more categories, and then to create category-specific targets. And now, if you look at here, this is, for example, the median levels of sodium in 4 different types of breads. And you can see they range from already were in 2015, ranging from 400 milligrams per 100 gram in your regular pantry, hearth breads and rolls and buns, up to a high of 680 in tortillas and wraps and naan bread. So you can see that if we just used one target for breads, we likely would have a very high target, while in actual fact, many more targets could be achieved if we looked at the breads by subcategories. And so I'll go on to show you in a couple of categories just how this translated. So these are the two extremes. So what we did is we took those median levels, and for the 2022 targets, we reduced them by 15%, excuse me. And you can see that that would reduce that 400 milligrams to about 340 milligrams, and that became the 2022 target, and a 30% reduction at 280 milligrams would be the 2025 reduction. And similarly, using the same approach for tortillas, which contained much more sodium, we achieved and came up with higher, although significantly reduced, sodium levels in the tortillas, rather than having one sodium target for all the subtypes or subcategories of breads. And as part of the feasibility and to look at these targets, we also examined both the maximum levels and targets, for example, that were set for these types of products in the US. They just recently released some proposed targets for 2026. They've now finalized them, but at the time we only had the proposed versions. We also looked at a number of targets you can see from 2017 in the UK. And you can see that, for example, in the UK, 95% of their products were already meeting that 450 milligrams, and they set a target of 400 milligrams for 2024. So you can see we're very reasonable. And then we also examined the member states within Latin America, and there the targets range from 286 up to over 600 milligrams. So you can see our targets were very feasible within the targets that have been set amongst other countries in the region, the UK and the US. And of course, we also examined the front of pack labels that have been set, the thresholds for front of pack labeling, as well as alignment with the WHO benchmarks that were being developed at the time and have since been published. And similar, we took the same approach by examining the sodium levels, not just per milligram per 100 grams of food product, but per calorie. And this allowed us to, for example, point out the products where the sodium levels would be quite dense. And these are, although higher than 1 milligram per kilocalorie, you can see that we also, when we examine that, some foods, for example, would be 4 or 5 milligrams of sodium per kcal. And so governments, when they set up food guides and other guidance documents, may want to keep that in mind, that there are many foods that even when they're reduced by 30%, may still contain significant amounts of sodium and would be high contributors to the intakes of sodium within your country. And now that's how we develop the sodium targets. And this is the way they're presented. As you saw, a copy of the report, and you can go and they'll be released and you'll see all the different food categories. And importantly, because there are a number of types of foods that are within each of these categories, we spent quite a bit of time speaking to food supply experts throughout the Latin American countries so that we had good definitions that were quite inclusive, as well as a number of examples of what types of foods would fit in each of these categories and subcategories, so that when either researchers or government agencies were both applying the targets and or monitoring compliance with these targets, that there would be minimizing the confusion of where a certain food product would fit. So we hope that that will help both the users of these targets, but also the food industry and others to have clarity with regards to the targets. And I want to finish, this is my second last slide, is just to overview. This was in the beginning of the document, but I think it's important to point out that we base these targets on existing data and targets within the Americas. These targets, although are voluntary, they're recommended as a starting point for product reformulation. And we encourage governments that they may want to set different targets or even more stringent targets that would be appropriate to their national situations. And they may want to consider regulated targets, which are actually much more, have been shown to be much more effective than voluntary targets. And of course, as like the earlier 2015 targets, it is likely that these regional targets will be revised as progress with reformulation continues over the coming years in these various key food categories and possibly other categories as we have more sodium data available, so that we can support a further downward shift of the sodium intakes throughout the Latin American region. And I think importantly, these targets can serve as very useful benchmarks for monitoring and evaluating the level of compliance with these regional targets. And we encourage that this work is being done in a transparent and open manner, so that both countries and the food industry and their health and NGOs within their countries know how they are doing towards meeting their targets, as well as safeguarding the process that you use in countries from conflicts of interest. And with that, I'd like to thank you all very much for listening to this very brief overview of how we develop the targets. There is a technical report that is available on the PAHO website, and the link is embedded within the copy of the report, and acknowledge the huge amount of work that was contributed by the Technical Advisory Group for Sodium Reduction in the Americas, but also the day-to-day, many meetings that we had with the staff at PAHO, as well as at Ontario Tech University, and Adriana Blanco-Meltzer in Inciensa in Costa Rica, who led the IDRC project that collected much of the data we used. And with that, I'd like to thank you all very much for your attention.
Thank you very much, Mary, and this shows the importance of the work of over several years, where we have been collating data, and we are now in a much better position to set and implement these targets than 6 years ago. So thank you very much for all your work in this, and the whole team and all institutions that have collaborated. There are a few questions on implementation So this is a moment that we would like to hear from two countries a little bit about what are their plans and how they can contribute and how they see the possibilities in their countries to implement these targets. So we have with us Dr. Eduardo Nielsen. He is a technical advisor of the General Coordination of Food and Nutrition in the Ministry of Health. And he will have the floor now.
Thank you very much. Oh, sorry, Leo. Thank you very much. Voy a hablar ahora en inglés porque es como está mi presentación. Entonces, so thank you very much for Mary for your presentation and Fabio before, and because it was very important. I'd like to thank you also for being part of this group. It's very important to be the work of the technical advisory group, along with all of this discussions on the regional targets. And I will start by addressing some of the context of policy in Brazil, which is, as many countries, a very huge burden of disease that is caused by dietary factors, but especially by sodium. It's one of the most important, to the point that 47,000 deaths a year are attributable to excessive sodium, and that also has a huge economic burden, not only for the health system, but also to economy because of the losses of productivity. So it is important as part of the shake package even to build a strong advocacy case, and also knowing the sources of sodium in diet. So as said, Brazil is not different from many countries. We consume almost twice the recommendation of WHO. So we consume 9.3 grams of salt per day, and a very little small percentage of the population actually consumes less than 5 grams per day, and they don't acknowledge the amount of sodium that they consume. And it's very important to know that there are various sources of sodium in the diet. So over 60% comes from table salt and salt-based condiments, and 30% from industrialized foods, processed and neutral processed foods. And it is important to also address that the participation of table salt and salt-based condiments have gradually been reduced over time, while the consumption of processed and neutral processed foods as sources of sodium has increased gradually. So it's very important for us to have multiple strategies. And so the policy approach, of course, has a strategy that's based on the reformulation of sodium, so to incorporate these targets, but also to include healthy food procurement policies, as an example of the meals in public schools, food consumed out of the households, nutritional labeling as the front of pack labeling that we have already passed in Brazil. And of course, very important to promote healthy and sustainable diets through our food-based dietary guidelines. And our sodium targets were based on the consumption of the Brazilian population. So we selected the foods that were most consumed by the population and most contributed to salt intake. And we set maximum salt contents that would be gradually reduced over time through biannual continuously reducing over time with very transparent monitoring. But it's very important for us to know that over time you have to reassess that and perhaps include new categories, continuously use the new international benchmarks as data from other countries, but of course regional targets as that's set by PAHO and other global benchmarks set by WHO. And as said by Fabio, I think that we started a voluntary process, but we look forward to sometime in the future transiting, as Argentina has done, to a mandatory process so we can reach more food categories, reach the whole market, and being able to monitor better this and reinforce these strategies. And just a little detail on the criteria. It's very important for us, as I said, about transparency. So we set all our targets based on a baseline and looking to the future with an upper limit for the category, which is intended to have the huge impact in a short time frame, but then acknowledging that we need to have time to continuously reduce that, but always looking, as I said, as at regional and international benchmarks that are where we intend to reach over time, and knowing that because it is adopted in other countries, it means that it's technologically feasible, but also that there is room for consumer taste adaptation over time. So it's something that we should take. And this is an example in Brazil, despite the progress that we have on the table on the left with the percentage of change of reduction in salt content, sodium content in foods, which we reached very good results. But at the same time, it's very important to know that we have achieved much in terms of compliance to the national targets. But when we look at the most stringent targets that we had in 2015 by PAHO, there is still room for improvement. And now with the new global benchmarks, anyway, the PAHO regional targets, and we have even more room to reduce sodium, and actually and analyzing our national data to include new food categories. And to finish my presentation, I'd like to speak a little bit about the impact of these strategies. And so we know from data by food industries that we have withdrawn large quantities of sodium out of the market, but it's very important for us to know the impact on health, on this huge burden of health that we've spoken about. So the estimated impact of the current targets are large, because all numbers in Brazil are large. So it could prevent or postpone 182,000 CVD cases, cardiovascular disease cases in the country over a time frame of 20 years, and reduce over 14,000 deaths. But at the same time, we know by comparing what we have achieved, which is through the current national targets, which is a reduction of 0.25 grams per day of salt, we could reach much more if we had adopted for all food categories the most stringent PAHO targets, which would mean reducing twice the amount of sodium consumed by the population. And of course, that would impact in terms of deaths and disease in the population. And to finish my presentation, I'd like to address, talk a little bit about some conclusions and lessons learned. And the first is thinking about next steps, is using, again, these global and regional benchmarks for resetting the targets and possibly including new food categories so we can improve the impact of this strategy. To stress how important it is that we have the cooperation between countries and the technical support by WHO and PAHO, and then additional information that we have the Decade of Action Network of Action on Sodium, which we are planning to have a meeting now in 2021 and several other meetings in 2022. So keep that in mind, that we will be in contact with countries, and so the countries that are already part of the network of action, but also inviting new countries to take part in these efforts, because it's a very important ground for cooperation between countries. And stress that it's very important for us to have multiple strategies, and for adapting all of these instruments that we have at the global and regional level, for these tailor-made strategies for the country-specific context. And of course, we always have this engagement and compliance of the private sector that we need to involve, but at the same time, it's very important to consider conflicts of interest, and based on that, have maximum transparency and impactful criteria on what we're doing, and continuously monitor and evaluate, and possibly model the impacts of salt, because in that way, we will have multiple scenarios that can be modeled, and we can have very strong evidence that can both strengthen advocacy, but also decision-making based on this evidence, so we can have the most impact and the most cost-effective strategies being implemented over time. Thank you very much.
Thank you very much, Eduardo. A very interesting presentation and a very good experience that Brazil has. So another country, otro país que tiene una experiencia muy buena en reducción de sal, y el único país de América Latina con...
There are other countries that have experiences on salt, and perhaps the only country that has compulsory goals in this regard is Argentina. And so we have Dr. Graciela with us, a national director for comprehensive approach to NCDs from the Secretariat of Access to Health from the Ministry of Health. So Dr. Graciela Avriata, you have the floor, and I thank you for being here. Thank you. I didn't really prepare a presentation because I was told we only had a few minutes. So I would just say that we have a law that seeks to reduce the salt intake in Argentina in our population. This law was passed in 2013, enacted or enabling legislation was drafted in 2017. In 2019, less salt, more lives was launched and we have a reduction of sodium in some food based on a voluntary agreement with different sectors of the food industry and also the bread making association. The compliance authority is the health ministry of our country that's charged with enforcement, and through its regulation, it sets the maximum levels of sodium in some foods, mostly. We've got processed meats, crackers, and others. Now, the ministry, the enforcement body, can periodically look at the progressive reduction of these maximum amounts as established. Other strategies established by law are, for example, to put health warnings on packages of salt that are sold and to carry out awareness-raising campaigns. We've also been working, and this is also part of the law, in restaurants, for example, to reduce salt, taking salt shakers off the table, and also to offer items on the menu that are low in salt and also with salt warnings, health warnings on the menus, and for them to offer other dietary type salts. Now, a strategy that has brought down salt consumption considerably was to reduce salt packages from 2 grams to nearly half as much. And so we also want to establish through measuring what the per capita per day salt consumption is. That consumption, despite all of the work that we have been doing, working in health policy, 7.9 grams. That's the level. That's nearly twice what is recommended by PAHO and WHO. Over the last couple of years, 2020, 2021, we've rethought salt content, and a warning on salt consumption is being considered for salt that's sold, as well as oversight by the food safety department at the provincial level is also recommended. We continue to work mostly on the national healthy diet and disease prevention program, working closely with the National Institute of Food to modify the Argentine food code that sets goals for 3 basic goals and groups rather, and subgroups. So meat and meat products, dressings, soups, conserved items, and flour-based items, working on 3 other groups. We've got cheeses. We always take into account the ingredients of these products, and we have been working on the cheeses most sold and consumed in the country, and those with which we already had a certain amount of experience because they had already taken part in these voluntary agreements that I mentioned at the beginning.
We also worked in Synapse. We showed a new reformulation proposal before the National Food Committee, and we're awaiting approval. We're working in sauces, modifying the content of sodium in mustards. And I wanted to tell you somewhat what the process was like in the reformulation of these foodstuffs. The proposal is carried out with an interministerial, intersectoral approval, seeking consensus in view of the makeup of each one of these foods and its technical viability. In that regard, we have been working with these new proposals, and we have planned to broaden the scope. Let me tell you finally that Argentina is a federal republic. Therefore, what happens inside our country by each one of the provinces, that's very important because that somewhat defines the impact that we have upon the population in general. Therefore, we have 10 of the provinces having legislation which meet the standards of our law 26,905, one that has norms of itself, the special standards, and only 3 of the provinces don't have standards, and another 10 which, although they have standards, they do not reach the level of the national standards. Lastly, and by way of conclusion, I think it is important for me to highlight that the voluntary agreements are very useful, but it is to have an active role on behalf of the state in order to govern and define goals, procedures, and timing. The law allows to have new goals on progressive reduction, and this is important with the new goals which are disseminated as a result of this webinar. We have a new horizon to be able to forge ahead. Also, having updated goals allows us to know what has been attained as a baseline and to plan a reduction, which is a challenge in the future. Monitoring and surveillance by authorities in charge of foods is very important, how to regulate them. And on our behalf, as part of health, continuous surveillance to reduce sodium content consumption among the population. As you've said, this is a very important day for us because in the Congress, there is being discussed a law that promotes healthy nutrition. This will allow us to regulate the demand for these foodstuffs, as well as the supply of ultra-processed foods in different institutions, both the educational organizations as well as labor organizations, a result of a resolution that we introduced this year, 2198, where we have been working with a national strategy for a healthy environment, which covers from the educational establishment all the way to labor organizations as well. So we deem that the future is highly promising, but we have to continue working on with a tremendous awareness and very strongly together with the industry to attain the objectives and basically to reduce the impact of this of salt consumption in the prevention and control of non-communicable diseases. In spite of everything that we have been doing, consumption to be quite high and the prevalence of blood hypertension, we have not been able to lower, according to the National Risk Factor Surveys from 2005 to 2018, prevalence is still 35%, and the percentage of deaths as a result of non-communicable diseases in our country is of some 72%, with which, as I said, we still much remains to be done. Thank you. Thank you. Thank you very much for sharing with us your experience, and much success to you today with all that you have now before you in order to promote healthy nutrition. It seems that we have reached the end of this webinar. We have tried to respond to some of the questions through the chat. There are some questions that I would like for Fabio Gomez to discuss very briefly and tell us what we are thinking to do on the score of taxes on foods and what PAHO believes and wants to do so that this momentum will not stop right here, but that these goals will actually be implemented. Thank you very much, Leo. So beginning on how we make progress and we transfer those figures and goals into actions and concrete policies. In that regard, we have been working in cooperation with the countries, supporting them so that they may indeed establish a map, a chart as to what are the necessary steps to implement these goals as mandatory goals in their respective countries. Depending on the country, there are different possible pathways in order to be able to carry out the red tape from the executive because of health regulating agencies as such, as well as the legislative environment, which may also come to support the adoption of these measures of such goals in a mandatory manner. But for all of this, there's a pathway, a necessary pathway to follow. This is how we're supporting countries which are about to design and to seek out the adoption or the actual implementation and the very monitoring and compliance with these goals. In that regard, therefore, we will be supporting our countries because it is they that have the deciding power. From PAHO, we are ready to serve the countries which in our region have been very diligent and very active in promoting steps towards supporting the protection of public health. We know that the lack of action in this regard, having these tools, does not mean that we're going to maintain the situation such as it is. We're going to make it worse because we have a trend toward worsening. So if we don't take any measures, by doing that, we would have a worsening of the situation of the region. And all the countries are aware of that, and they're trying to forge ahead. We will support the countries so that they may be able to transform these figures into policies and to demand effective changes by means of regulatory measures. As regards the application of taxes, I coincide with the question, which seems to be a suggestion that countries may try to seek out this policy. What has prevented many countries on deciding to follow this pathway has to do with interference by those actors which are going against public health in some of the countries. And there, indeed, there is the possibility and the benefit of being able to apply a tax which might be designed especially for the country, considering the country's reality. And this is indeed part and parcel of what we have been discussing with the countries among the different policy options they might consider to support a reduction in sodium intake in the countries. I do coincide with the fact that we must have a larger number of countries in our region that give thrust to this measure. Without this innovation, we will not be able to generate this demonstration effect, which is tremendously important, as you acknowledge. This always starts with a leading country. So, as the case of sugar, Mexico took a first step, having the front labeling together with Chile, and we must continue to work together with the countries to find the countries that may take these steps to improve and to make the policies evolve. How do we move from a figure to action itself? We'll have some countries that will commence certain actions. The next will learn from that experience. For example, what Brazil and Argentina have just told us, which are the lessons learned so that we may have a better performance, not only in those two countries, but in other countries as well. This is the evolution process of policies in our region to be able to have numbers that will be transformed into policies and actions that will be beneficial to the population of our region. Thank you. Thank you, Fabio. And very briefly, the question regarding taxes on food as they have in Hungary. Can you tell us something? Yes, in that regard, this is an option indeed. We know and we have the evidence and we have seen that the models have been studied as well as the experience in the real world, such as the ones you mentioned. And evidence has shown to us that if we apply this rightly, there will be a reduction in the demand, and taxes are indeed measures that have the capability of reducing the demand. So then it is up to every country. We have to study this whether we're going to be doing something very broad or categories of specific products. What is the elasticity and the pricing of such products? Yeah, we're going to have a category of a much broader group of foodstuffs. But in spite of all of this, what we can say in general terms is that to increase prices and apply fiscal measures has the capability of reducing the demand. If we want to reduce demand of excessive sodium products and to reduce the content of sodium in such products, that would be a step that would be indeed very effective and would help our countries. So in that regard, this is an option that we're trying to find with the countries. And the reason why we have not yet managed in any of the countries to do this, having to do with the interest of opposing parties. We know that taxes together with marketing are indeed the group of policies that oppose process and alter process producing corporations, because these are the policies that have a greater effect upon the reduction of the demand. It is because of that reason we know about taxes to sugar drinks, beverages, but we know that that's a group of products, and we've seen tremendous resistance in that regard, precisely because it is a highly effective measure. There is tremendous resistance and opposition on the part of ultra-processed product corporations. Well, thank you so very much, Fabio, for these comments. And it is indeed very true. What we're witnessing today is part of a package of steps which are much broader to remove the incentive of high content salt products. This is all part of the package of WHO, and they're all best buys and cost-effective interventions. Indeed, it is true that we have today launched these goals. There's a technical document now wherein all of the goals are shown on the webpage, which is already open to you. And there's a brochure as well, which has to do with the politicians, directed to politicians with questions and answers that you may consult and use indeed in order to help you in the advocacy effort. And we too are launching some banners and some clips that will be finished throughout these days that you may be able to use in these advocacy efforts. So that is the sector of civil society, which has indeed a very important role to play, and the administrations and governments that must be the leading factor. With this, and the industry, of course, which too has to collaborate in the implementation of all these goals. Therefore, I merely want to wish everybody, especially our panelists, because of their presence here today, our interpreters, of course, and of course, all the actors and people who have participated in this process, the collaborating center of WHO, University and the University of Toronto, together with the Technological University of Ontario, which has guided this process, this technical process, also with the support of the Costa Rican Institute for Research and Teaching in Nutrition and Health, as well as our technical consultative group on prevention of cardiovascular disease by way of the reduction of salt intake, and all those countries that have collaborated, as well as the support given by the Results to Save Salt to Save Lives, which has been so important in this process, and what comes in the future as far as the implementation of the goals. There's some questions we have not been able to answer. Please write to us through the electronic email. I will be in contact very soon for future events for the dissemination and implementation, and you can count on our support. Thank you so very much, everyone. May you have a good day.
Gracias. Thank you all.
Thank you all. Bye-bye.
Thank you. Bye-bye.